In 2012, 3.8 million concussions were reported through the emergency room records, doubling the number that was reported in 2002. A concussion, which is a form of traumatic brain injury, occurs after a blow to the head. The brain is surrounded by a fluid and protective membranes called meninges, which usually cushion the brain. During an impact, the brain is pushed against the inside of the skull and can be bruised. In addition, different parts of the brain can move at different speeds, producing shearing forces that can stretch and tear nerve tissue. The mild effects of a concussion can result in nausea, short-term memory loss, the loss of consciousness, as well as consistent headaches. Some of the more serious effects can result in Parkinson's disease, aggression, depression, anxiety, and a complete memory loss, as well as a disease called chronic traumatic encephalopathy, also known as CTE. According to Boston University, the leading team of researchers who describe CTE as a progressive degenerative disease of the brain found in athletes and others with a history of repetitive brain trauma, including symptomatic concussions as well as asymptomatic subconcussive hits to the head. Because the brain injury was already sustained through the concussions, as of yet, there is no cure for CTE. Researchers are studying what exactly CTE is and what we can do to prevent CTE. Although CTE has just been recently discovered, it has been given ample support to increase the awareness of the dangers of concussions so that less families are devastated by the effects of it. So why should we care? And how does this affect us? When we think of concussions and CTE, we generally think of sports-related injuries. But CTE can happen to anyone that has suffered from multiple concussions. By increasing awareness of CTE, the researchers' hopes are to educate the general population that concussions are not just a simple injury, but are very complex. Through this research, we are given the opportunity to educate ourselves of the dangers of concussions and what we can do to prevent the permanent injuries to our brains.